Hello, everyone. Welcome to the latest in public health research series for the semester. I'm going to wait a minute for everybody to log on and get situated. Welcome, everyone. Nice to see you all. We're really excited to have our first latest in public health research series speaker today. So welcome to the series and welcome to the start of the semester. I'm Lauren Goldstein. I'm the Assistant Dean for Research at the School of Public Health, and I facilitate this series. Really happy to see you all. And Jennifer Ahern is here today. She is the Acting Associate Dean for Research and Executive Associate Dean at the school. And today we're really happy to have Layla Kwong presenting her work on heat stress and pregnancy outcomes in low and middle income countries. So welcome to Layla, and I will put in the link for everyone if you are taking the course for credit. We have an attendance sheet, so I will put in the link to that in just a minute. So welcome everyone, and thanks, Layla. Over to you.
Yeah. All right. Thanks, everyone. Hi, thanks for letting me be the first speaker of the new year. I hope everybody is, settling in school, finding some good classes, and getting to know a lot of your great classmates. So yeah, generally, I'm a assistant professor in environmental health sciences, and I generally work on interventions, primarily in Bangladesh. But this is one of the few studies I have that is not an intervention. It is related to an intervention. So I am interested in how exposure to heat stress is affecting health of different populations, and specifically how we can reduce that exposure through household interventions, like say you can insulate a house better, or you could improve the ventilation better. So that study is funded by NIH, and we're in the middle of data collection right now because it is the hot season in Bangladesh. Earlier was the rain, it was a bit cooler. Now it's getting really, really hot. Again, just like it is in May. So I'm not presenting on that today just because the data collection is still in process. But I'll talk to you about a systematic review and meta-analysis we did that kind of like motivates why we're interested in this, right? So there's a huge range of outcomes for the way that heat can affect health. And so today we'll be talking about the pregnancy outcomes. I will probably refer to pregnant women rather than use any other term, because in all of the studies that we reviewed, we have no evidence that there was any gender women reported in the studies. So that is the term that I will be using. This work is primarily done by my PhD students and Doctor of Public Health students, Kara Schulte and Sophie Cotton, with the help of some very dedicated undergraduates. So I really love working with students, and I'd be happy to work with anyone here if you're interested. I know there are some faculty on this call. I knew there would be a lot of students on this call, so I did include some more explanatory slides as well, just to help them along. Okay, so I also know my internet is a little bit wonky, so sorry if I disappear or something. I'll try to get back as soon as possible. Great. So the learning objectives are really just sort of understanding some impacts of extreme heat on health and the projected sort of magnitude of effects, describing factors that influence heat stress, explaining the pros and cons of several measures of heat stress, learning the basic process of a systematic review and meta-analysis if you've never done one of those or if you've never read one of those, and really exploring some reasons you should think critically about what you read. So a lot of you are just starting out right now or getting back into school, coming back after a summer. And, I think it's really easy to read something in the published literature and be like, okay, I get it. That's the answer. Like that's what they said. It's peer reviewed. But that doesn't mean you should believe everything you read or take it at face value. You should really think critically about what are they saying? How does that compare to what other people are saying? Why you may or may not want to, trust all parts of that study, right? I'm not, we do have a rigorous peer review study process, and so hopefully most studies you read are mostly correct. But I just want to encourage you to look at things more in depth. All right, so what are some health impacts of extreme heat? All right, so I don't have that much time, otherwise I'd ask you to put it in the chat, but think for yourself, what are some health impacts of extreme heat? We can start off with physical health, which is maybe the most obvious to you, sort of dehydration, heat rash, heat stroke. It can even lead to death. It can lead to higher rates of respiratory infections, chronic disease like diabetes or kidney disease. And then we also see with pregnancy outcomes, which we'll talk about more, miscarriage, preterm birth, and low birth weight. In addition, we have mental health impacts, right? There might be more hospitalizations for behavioral disorder and altered behavior. And then one that we don't usually think of as is very salient is sort of the cascading impacts. So it's kind of hot where I was the last 3 days. I don't know about where you guys were, but definitely, usually on the weekend I'm out, riding my bike, running, going hiking, doing something. And it was like kind of hot. And I was like, oh, maybe I will, exercise later in the day, or maybe I'll just like skip that today and I'll go out tomorrow or something like that. So thinking about these cascading effects and how they can affect your health as well. So how big of a problem is this? Well, the current estimate is that temperature extremes, not just heat, but also cold, have lethal consequences that kill about 480,000 people per year. So this is not small. This is equivalent to the number of children under 5 that die from diarrhea every year. So before I started researching heat, I was working in water sanitation and hygiene, and that's a very motivational number. You're like, that is a lot of people. And I really, when I started working on heat, I didn't realize how big it was. So it is a substantial number of people that are estimated to be dying from extreme temperatures. So a lot of this is attributed to climate change, and importantly, sort of for policy and action, it is important to attempt to quantify how much money this is costing us. So 3.6% of GDP in 2100 is estimated to be a loss for adaptation to extreme temperatures, right? So we're going to spend a lot of money, with better insulation, installing more heat pumps, right, on the energy used to power those heat pumps and air conditioners and things like that. And so we want to think also sometimes it's motivational to some decision makers to think about the environmental consequences of climate change. And I do want to point out, so again, it's 480,000 people estimated to die each year is the current estimate. We estimate that by the end of the century, this could be even larger than all cancers, right? Model. You can go read this paper for yourself. Models always have flaws and you can disagree with them. But, it is, I think, the scale of this. I do want to point out that right now, currently 10 times more people die from cold stress than heat stress. So while I'm focused on heat and while heat stress is becoming a bigger and bigger problem, currently a lot more people are still dying from cold stress than heat stress. So I just don't want to ignore that, right? Because the last two stats I was talking about temperature extremes. I mean, I think it would be surprising for us to know someone who had passed away from cold, but that is quite common still in globally. Okay, so I want to start out with what is heat stress and how is that different from temperature? They are different, first of all, and that's really important to recognize when you read the literature. So heat stress is a combination of the dry air temperature, humidity, the airspeed, and solar radiation, right? So you know this from your everyday life, right? It can be, 90 degrees Fahrenheit and you can be in the shade of a tree or not in the shade of a tree, right? It feels different. You can be in an area where there's some light wind going by you and it feels very different than if the air is still, right? Because that wind is helping take away the sweat from your body and helping you cool down. You can be at 88 degrees Fahrenheit in a, Texas or Arizona, or you can be in, Maryland, right, where it's much, much more humid. So you know this from your own experience that temperature is not the same as heat, and you can feel much hotter when you have these other elements added to it. Heat stress also considers how much clothing you're wearing, right? Because the primary way that you cool down is through sweating. And so if you are covered from ankle to wrist, you're not able to sweat as well, right? If you have a hat on, you're not able to lose the heat through your head as well. And so this is important when we look at studies, and almost none of them consider what clothing people are wearing, right? But it actually matters because the ambient temperature might not reflect the sort of heat that you're actually feeling when you consider sort of the clothing people are wearing. It's also influenced by metabolic activity, right? So you can be generating your own heat through exercise, through physical labor that you're doing as part of your work. Pregnant women can be generating metabolic heat from the fetus inside of them, right? And so this also influences the heat that people actually feel. So temperature is not the same as heat. And I think it's important to keep in mind throughout this talk. Okay, so if my slides would let proceed. Okay, so one issue with this field is that it's kind of new, and thinking about heat and thinking about how we quantify it, and then thinking about how it's impacting health is like sort of even newer. So one issue is that the researchers and experts in this field have not agreed on the best way to measure heat. So there's a bunch of different metrics you can use, and you can see just a subset of those listed here on the left. And there's a bunch of different metrics you can judge them on, like how good is this criteria? How well does it reflect what the things that we're interested in? And so there was one study that, collected all these criteria and tried to analyze which ones are sort of the best. They based it on, how well does it actually correlate with core temperature, body temperature, or mean skin temperature, or your heart rate, right? And so they looked at a variety of different ones, and they conclude that, the wet bulb globe temperature, or the universal thermal climate index might be some of the best out there. And I point this out because, when you're trying to do a study, you could choose any one of these, but you try to compare your results to any other study, and they might have chosen something different as their metric for heat stress. And so how are you going to compare those, right? So I told you we're doing a systematic review and meta-analysis. How are we going to compare the results if people are using different definitions for the exposure, right? And so that is one area where this field still needs to sort of like coalesce and decide on something to at least make things more comparable across studies. So currently the best heat stress indicators are this wet bulb globe temperature. And I just want to talk about some sort of assumptions that going into it. So when you look at the wet bulb globe temperature, which combines temperature, humidity, and wind speed, and you can modify the equation to get clothing metabolic activity included in there. There's some modeling that finds that the sort of upper limit of human survivability is 35 degrees Celsius. So this is approximately an air temperature of 38 Celsius with 80% humidity. And then the upper limit for human productivity for acclimatized individuals is about 33, right? Because it's like, okay, well, if you're alive, but you're just lying on your bed, that's not really going to keep you alive, because usually people need to work to earn money to eat food. So this is why it's looking at the upper limit of human productivity. And an acclimatized individual is one who has lived in that warm setting for at least 10 days, right? So your body has kind of adjusted a little bit. If you are a non-acclimatized individual, then, if you go to that hot place, you're not going to be productive as productive as the person who lives there, because you're just tired, right? Your body's adjusting. And that will come in to what we talk about later. A second heat stress indicator that's widely used is the Universal Thermoclimal Index. It again combines temperature, humidity, wind speed, and radiation, and it also accounts for typical clothing, right? So the first one assumes direct sunlight, and this one assumes shade, right? So we already have some differences that we might want to change. Generally, you might be able to find a chart like this where you calculate or estimate wet bulb globe temperature based on the temperature and the relative humidity. And these different colors that are associated with the temperatures can indicate sort of what are safe activities. So for example, green activities, your body is stressed by 45 minutes, take a break, stay hydrated, but is fine. Yellow activities, you're stressed after 30 minutes, you might get heat cramps, right? So there's other types of recommendations. And then red and black get more and more severe. So this is something that athletic coaches might look at when they are, scheduling soccer practice or something like that. And more sort of employers are looking at when they are working with people who maybe are outdoor workers, right? And what kind of working guidelines should they have for them? So here's another one. This is the physiological effective temperature. And again, it's comparing itself to the UTCI, the Universal Thermal Climate Index, the wet bulb globe temperature. And there's some more there that get compared. And again, this is just to show how there's like kind of overlapping, but not quite. And we're not quite, clear on, what levels that we should be worried about, because this spills over into how we interpret the results from our systematic review and meta-analysis. Okay, so assumptions for each index. I'm not going to go through these in detail, just to say there are different assumptions. Again, so like how do we compare these different definitions of exposure to heat when we're trying to do an analysis of the data? Another thing that's really important to consider is, right, there's ambient heat, and where is everybody right now? How many people are outside, right? Raise your hand if you're actually literally sitting outside right now. I'm not seeing very many hands go up, either digital hands or real hands. Not a lot of us in the United States or in other spend time outside, right? 80 to 90% of people's time in high-income countries is inside, usually in climate-controlled buildings, right? There's definitely areas where, air conditioners are not available, air conditioners are too expensive, fans are available, but they aren't cooling you to sort of your optimal temperature. They're just cooling you down a little bit. So I'm not saying that everybody in a high-income country is, in an optimal situation. Obviously, there are also a lot of outdoor workers. There's people driving delivery vans, right? Agricultural laborers. But in general, there is not as much exposure to the ambient in high-income countries as you might think. However, in low and middle income countries, there is less indoor cooling. So even if you are inside, you aren't having this climate controlled atmosphere. And there's more time spent outdoors, right? Because there are more people who are working in outdoor laboring and agricultural sectors. So in this graph, you can see the prevalence of fans and ACs in different countries. ACs are in orange, fans are in blue. And on the x-axis, you can see how this is associated with income levels, right? And so I'm really focused on, in this study, we're looking at just sort of anybody in middle income country, but my research on housing that I mentioned earlier is really focused on low income households, right? Because you can see that the prevalence of fans and air conditioners in India is like less than 10%, right? And so really my intervention work is focused on that population. But just want you to think about, what does it mean when we look at all these studies and they're looking at ambient temperature when most people are not experiencing that ambient temperature? Okay, so what is some thermal physiology of how heat is affecting the body? This is really important when we're thinking about all of the diseases that and issues that heat can cause, but especially pregnancy, because we have many ways we could look at things, and what is the most reasonable way. So I have a couple zoomed in here. So when you are exposed to high heat, your heart needs to work harder, right? So you're going to have you're trying to move that blood from your core to your skin, right? And then your heart is going to work harder to do that. It's going to increase your heart rate, and eventually that can cause cardiovascular strain. Another thing that can happen is that you get dehydrated, right? Because you're sweating a lot. That's the way that you're cooling down. And this dehydration that can cause fluid loss, and here, I'm just trying to move my controls, can cause fluid loss and then lead to hypovolemia, which is, that's just another word for fluid loss, essentially, which can cause microbes or other proteins that you don't want to enter your bloodstream. Things get a little bit porous. Your blood can get porous, and then you can get unwanted toxins inside your bloodstream, which can cause cell-related death because they're not supposed to be in there, right? And so the cells are reacting to them in a negative way. So these are the different sort of
I think we lost Layla for a minute, but hopefully she'll be right back. She has her internet's a little bit spotty where she is. Layla, if you can hear us, you could try shutting your video and then see if that's better. Oh, okay, we've lost her for a minute. She will be back. I can also share her slides if people want to look at that slide. Hold on one second. Sorry for the technical difficulties. This is the slide that she
Okay.
was. They're back now. Okay, good. I was sharing your slide just so people could look at the slide while you were
Okay,
gone.
great.
Do you
So,
want me to stop? I'll
okay, let me
stop
try.
sharing. I'll stop sharing my slides so you could share your slides.
Sorry, I don't know what happened, but
Okay.
anyway. Um, sorry about that. Okay, let's try this. Okay, can you see this
And then we
slide?
see a like a PubMed search or something.
Okay, are we back on the same slide?
Yes. Susceptible and vulnerable groups.
Okay.
Yes. 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 Yeah. Thanks.
Yeah,
Thank you.
sorry.
Yeah. Yeah. Good.
Okay. Okay, perfect. All right. Sorry about that, everybody. I don't really know what happened, but anyway. Okay, so these are the susceptible groups. Again, susceptible is more about something about your physiology that is causing you to react more strongly. So women have a higher volume to surface area ratio than men. So if you have a higher surface area, you can sweat more, right? So it's easier to dissipate that heat, which is why women are considered a susceptible group. Older people are considered susceptible because they have as many sweat glands as you have, but they can't produce sweat very well. That system just doesn't work as well when you get older. And so again, because sweat is the way that we're cooling down, if you can't produce sweat that well, you're going to not be able to dissipate that heat, right? Chronically ill folks, sometimes the medicine people take can also cause them to not be able to sweat or cool down as well. On the other hand, we have vulnerable groups. These people, their physiology is sort of like quote normal, but they just have a lot of exposure, right? So outdoor workers, people without access to cooling are some of those people who are counted as sort of vulnerable groups. And the reason I separate these is because you might think of different interventions for different people, right? So I can't, an older person, I can't change your sweat glands, right? And so you might just need less exposure to heat versus, vulnerable groups, we might have a different type of intervention for you. So that's the reason I think about these separately. All right, so now we're going to dive into the pregnant women. This is the effective heat stress on pregnancy outcomes. So there have been quite a few studies on this, quite a few reviews on this, especially lately. It's getting a more hot topic. And the reason I wanted to do another review is because the current estimates are about, you have an increased odds ratio of a negative outcome of, 5 to 15%. These studies are almost all from high income countries, and they're all take ambient temperature. So they're assuming that women are exposed to outdoor temperatures throughout the entire day, right? 24 hours a day. And again, we already said people are not really exposed to ambient temperatures 24 hours a day, especially in high income countries. So what we did is a systematic review and meta-analysis. You can see here that we started off with a lot of studies, 9,454 studies, which is why it was great. We had a lot of dedicated undergrads to help with this study. And so we got down to just 9,000 that all had to be screened. A lot of them were not appropriate. And so we ended up with 124. We still ended up excluding 68 of those because they didn't have, a relevant exposure or outcome, or weren't actually in an LMIC, even though we thought they were based on the abstract. And then we included 56 studies in this review. Okay, so What kind of studies did we get? Some studies, we did want to separate the studies that were for, or at least examine how many studies were in upper middle income countries versus lower middle income countries versus low income, because again, the prevalence of cooling indoors is different based on sort of income categories. We had a lot of studies from Asia. And not that many from the Americas. When we looked at different outcomes, you know, most studies somewhat good coverage, I would say, from the other continents, but not nearly as many studies as from China. We also were interested in sort of urban versus rural, because again, you're more likely to have the electricity to power mechanical cooling sources in urban areas. Of course, you also have urban heat islands, so you might have more heat in those areas too. Whereas rural homes might not have mechanical cooling system, but they might have more traditional architecture or building materials that support more cooling indoors as well. However, you might have more outdoor workers in rural areas. And so just trying to understand sort of what the studies might be looking at. We found a range of statistical methods that different studies were using, and we'll talk more about sort of what the pros and cons might be of this range. We also found that there was a variety of study designs that people were using. Okay, so I'm going to show you some funnel plots. And so I just wanted to explain what a funnel plot is. So when you are looking at a bunch of different studies about the same topic, you kind of want to understand how do they compare to each other. And one of the things that we look at is like, what kind of bias might you be finding in the group as a whole? So on the x-axis, this is sort of like the effect size, the study result, the estimate of how much, you know, the exposure affects the outcome. And on the y-axis, you're looking at the study precision, usually measured by like the standard error. And so each of these dots represents one study or study results. And I'll say a lot of our studies had many results. So it gets a little complicated to interpret. But the middle of this funnel or triangle is sort of an estimate of the overall effect. And what you would want is you'd want the studies to fall sort of symmetrically on both sides of the funnel to indicate that, you know, there are some studies that are finding slightly bigger effects, some studies that are finding slightly smaller effects. You know, the smaller studies generally have, you know, less precision because they didn't have as many people in them. That's what you'd sort of expect to find if there was no publication bias. However, if you're sort of finding a lot of studies just on one side of the funnel, then you're like, I wonder if, you know, the studies that didn't find the expected effect, or, you know, especially if they were smaller, just weren't getting published, right? We know that there's generally, you know, and we're trying to fix this, but there's generally sort of a bias of like you publish findings that look interesting, right? And so you might not submit or you might not get published if the result was maybe not as interesting or as expected, let's say. So I just wanted, that's an overview of funnel plot, and I'll give you the funnel plots for many of the graphs so you can sort of eye quickly for yourself what you think about the results. Okay, so this is the first one. This is the effect of heat stress on stillbirth. And in these studies, heat stress is defined as high heat stress versus moderate heat stress. So that's kind of unfulfilling, but very few of our studies had a specific temperature threshold. It wasn't like all of these people were exposed to 95 degrees Fahrenheit in their first trimester or in their week before birth or an average over their entire pregnancy. Most of them said, you know, we looked at how many days the woman was exposed to a temperature that was in the 95th percentile of temperatures, you know, throughout the year, and compared that to the number of days that she was exposed to less than the 95th percentile. And so you'll also see that the colors here represent different trimesters or different exposure periods. So in the literature on this topic, they often have different exposure measures, and they also have different exposure periods. So some studies look at what was the woman being exposed to, what temperatures or heat was she being exposed to in the first trimester, second trimester, third trimester, month before birth, week before birth, day before birth, over the entire pregnancy. Some also look at the 3 months prior to conception, as we know that physiologically heat could have some impacts in that area too. Okay, so again, this is just the funnel plot, so you can assess for yourself, okay, what do we think about bias here? And sort of here are the results. And so I'll just explain how to read this study because read this plot because many of them are the same. So we put the study author and the year, and then we put the exposure period, T3, and that also corresponds to the color, right? So you have the color over here to help you read that. So, optimally, we wouldn't include all these different exposure periods on the same graph because you might think sort of the physiology is different during those different times, right? Like the baby has very different things going on in the first trimester than in the week before birth, right? And so you might expect that the heat could affect them quite differently during those different times, but we don't really have enough studies total to separate out all the different exposure periods. And so that's why we've lumped them here on the graph. But that is one issue that we'll talk about, is that these are not really physiologically based exposure periods. So given the sort of combining that we had to do, what we see is a pooled estimate of with an OR of 1.03. With a 95% confidence interval that barely does not cross 1. All right. So here's the next one. This is moderate to high heat exposure on preterm birth. So we have a lot more studies for preterm birth. And again, you can see these exposure windows include preconception, each trimester, week before, month before, entire pregnancy, and the pooled estimate. And so you can see visually with your eyes, you can be like, does there seem to be a difference between first trimester, second trimester, third trimester, or, 1 week, 1 month? A little bit hard to tell. We have a pooled estimate here of 1.08, again, which is significant. Okay. Here we have heat wave, not a lot of studies, pretty hard to do a forest plot or a funnel plot when you don't have a lot of studies, but that's what was happening. So it's helpful to do this systematic review also to see where the gaps are. What are we not considering? What are we not looking at? What are we not researching? And what might be more helpful? Okay. So a higher estimate, but not statistically significant, and many fewer studies in this area. Heat wave also does not have a consistent definition anywhere. So some people will say, 3 hot consecutive days, and you're like, okay, well, what is hot? Again, usually doesn't have a specific temperature threshold, usually is the 95th or 90th or 85th percentile of something. But, even a heat wave in San Francisco might be different than a heat wave in Vallejo, or in the Central Valley because of the sort of standard temperatures that people are used to, right? So again, exposure differences here. All right, this is another one for increase of 1 degree Celsius in preterm birth. Okay, so you've already seen that people look at high versus medium, they look at heat wave, and now we're looking at an increase of 1 degree Celsius, right? So different ways, again, of categorizing exposure here. So those are some results, and then we get heat waves and low birth weight. So this low birth weight is just a binary. Are they counted as low birth weight or not? And I'm going to speed through this because I want to really get to some problems that we found with this study. So we're going through the literature and we're like, okay, that's interesting. There is a lot of variation going on here, which makes it quite difficult to compare anything to anything else. So we did our best, but this is the part I want you to have the main takeaway when you go read papers for the rest of the semester and the rest of your year, is what kind of things might you want to think about. So I think of myself mostly as an exposure scientist. So I'm particularly interested in sort of how people characterize exposure. We don't have good measures of how much heat people are actually exposed to, right? Most of the studies we looked at just included temperature. Some of them used some combination of temperature and humidity, looking at wet bulb globe temperature, but assuming a specific airflow, assuming a specific radiation. And I put this picture up because these are the houses that I'm working with in Bangladesh right now. And this corrugated iron can absorb a lot of solar radiation and send it directly into the house. Right. So even the indoor temperatures can get very, very hot. And the solar radiation can also reflect into this open space in the alleyway. And there's corrugated iron on both sides. So, right, that's really magnifying people's impacts there. There's also very little shade or tree coverage in this area. Another thing is that, again, in all of these studies, except for one, there's sort of an assumption that people are exposed to these ambient temperatures all day long, which, again, I think we have data that shows that in low-income countries versus high-income countries, people are more exposed to ambient temperatures, but it's certainly still not 24 hours a day. Right. So what we would like to see is more personal exposure data. This is what I'm doing in Bangladesh right now. We have people wearing little monitors as like necklaces, and that is capturing some temperature and humidity, and we're estimating radiation. It's really hard to get airflow still, so we are doing some estimates of that as well. Okay, secondly, again, we talked about many different ways that people are looking at heat stress, right? We don't have a physiological basis for what we should consider risky or risky for particular outcomes, right? So are you looking at stillbirth? Are you looking at low birth weight? Those might have different temperatures that put the fetus at risk at different times. You can imagine that premature birth might be triggered by a few hot days. The fetus is already viable, and the body's like, man, we got to get this thing out of here. Like the core temperature is getting too high because of this internal metabolism. So, there might be a premature separation of membranes, and, the baby comes out early, versus low birth weight might be a chronic exposure to heat where the uterus is not getting enough blood because that blood is being sent to the arms, your hands and your feet to help leave the body through sweating. Right. And so I'm not saying we should have one definition for heat stress. We should probably have different definitions for different types of outcomes and different times during pregnancy. But the science really isn't there yet, because a lot of these are just epidemiological studies that are looking at, ambient temperatures and just trying to come up with these bigger correlations. But we should consider whether it might be more accurate to use a specific temperature threshold, like 95 Celsius, 135, 95 Fahrenheit, 35 Celsius. And this might be relevant because the heat shock proteins in your body or gut or other microbiota might be upregulated or downregulated or denatured at certain core body temperatures, right? And which is influenced by that ambient temperature. So rather than just saying, oh, the person is experiencing hot relative to their norm, we might say, what temperature is actually causing these microbiological or biochemical shifts in the body. I'm not saying we shouldn't use the percentile of temperature and heat. Again, core temperature may rise faster at the same threshold for someone who's unacclimated to heat versus those people who are. So maybe this is still, we can think about how this plays into the physiology. And we also don't know what lag periods make sense. A lot of these studies that we looked at used a variety of lag periods, but we don't know, when you're hot, and then there's biochemical changes, how quickly that might affect a fetus. So those could be other things we could look at. I explained how there's multiple exposure windows that people look at, and those are sort of out of convenience. But it would be really helpful to have a physiological understanding of, when is organogenesis is happening. You might think that there might be effects on a fetus at that time that would be different than after organogenesis is finished. When is that separation of membranes happening? It could cause stillbirth if it were early, or it could cause preterm birth if it were perhaps a little bit later on. So something to consider there. There were a number of different outcome measures. I mostly quickly went through sort of stillbirth, preterm birth, and low birth weight. Some of these outcomes were based on sort of self-reported due dates. Some were self-reported birth weights, which, I'm not great at estimating weight. Maybe you are, but I think I wouldn't trust self-reported birth weight very much. Some studies that didn't really have gestational age just assumed that children were full term, which doesn't account for children that might be low birth weight because they're premature, which is very common in LMICs. So it's not because of heat. It's because, they were already being premature. And then some studies combine different adverse outcomes. So one issue with this is it doesn't really give, given the different physiological processes involved, it doesn't really help for us to know that there's an increased risk of adverse outcomes where the outcome could be stillbirth or premature birth, or low birth weight altogether. I mean, it still shows us there's a health impact, but it doesn't really help us understand the physiology of at all, and it could even mask the effects. Okay, so there were also some unsupported statistical analyses. So I hope you learn more about these in the stats classes that you're taking. Some studies just didn't adjust for confounding factors at all. So you can think about the consequences of that. Some studies ran hundreds of comparisons. So there's one study that, again, because we don't really have standards for how things should operate in this field, we don't have standards for what extreme heat is or what time period you should look at or how long before the outcome you need to look at the exposure. Some studies are like, okay, we'll just analyze everything. So this one study had 814 comparisons. And so you're kind of like, well, okay, in that case, how many statistically significant associations do we expect? All right, so put in the chat, this is your interactive time. When we have p equals 0.05, right? What does that really mean? How many statistically significant associations would you expect to find just by chance, given 814 comparisons? Just by chance. Okay, so put it in the chat. I don't have the answer here on the slide, so it's not coming up. But I just want you to think about this because this is a real problem in this field where I see the attempts by authors to address the lack of standardization in the field. People are just doing their best, but you can see how it might also result in some misleading conclusions if we're pulling out results and we're like, oh, look at this, when those might just be by chance, right? Because of the way that we've defined statistical significance as p equals 0.05, right? So again, you can see here the number of legs that were attempted and the different percentiles of temperature that were examined, and they had substantially different results. So what does this overall tell us? Very hard to say, right? Very, very hard to say what it overall tells us. Okay, so I thought I had something else, but I guess not, which is good because there's still 7 minutes for questions. So happy to take any questions people have sort of about the overall study or even the study that's going on in Bangladesh at this time.
Great. Thanks so much, Layla. That's
Yeah.
fantastic. So many complicated factors to consider and lots of great reminders for questions to ask if you don't have good definitions. So thank you so much for that. It's really valuable. How about if people want to either raise your hand on Zoom or just chime in or put a question in the chat?
Can I go?
Yeah, go ahead, Ms. Beth. Yeah.
Hi, Layla, great presentation. I guess
Ms. Beth.
given the sources of variability that you just mentioned, how did you design the intervention that you have going on in Bangladesh, and how did you pick the timing of intervention given all of the biases that you're
Right.
describing here?
Okay, so right now, great question. Right now, our study is on people who live in corrugated iron homes in low-income neighborhoods, not specifically on pregnant women. So it's not a pregnant woman cohort because that would just take too long to find and enroll the pregnant women. We are also working with a group in rural Bangladesh that is a pregnancy woman cohort, but that's not intervention. So hopefully we'll be able to get some, primary data to contribute to the analysis here, but the study that looks at the intervention is just people in general, because right now we're just trying to get a baseline of like what what is personal exposure to heat in these areas. And we're doing children sort of as young as parents will allow for them to wear this monitor, as well as older children and women and men. So that's sort of a understanding what the situation is, and then measuring the environmental outcomes and the personal stress outcomes. But that the intervention is not yet for sort of pregnant women in particular.
Okay.
Because I don't know yet, you know,
Yes,
I
okay,
didn't
that makes
feel
a lot
like
of
we had
sense.
enough information to propose an intervention.
Sounds good. Thank you.
Yeah. Any other questions? It can be sort of on anything. I know I went through, you know, the results quite quickly. It was more to just give you an idea of what we're seeing.
Did any of the present studies you reviewed account for cooling? There's a question in the chat.
No, they did not. There wasn't really. Some studies, especially those from China, mentioned that there was cooling available, you know, let's say to 37% of people that lived in urban areas, but they didn't try to account for that in their model per se. So at least they mentioned it, which was good, but they didn't do any accounting for it. And yeah, that's why I think sort of looking at things on a personal level can be very helpful rather than just ecological.
Yeah, definitely. Laura, I see you have a question.
Yeah, hi. Thank you for the presentation.
Mhm.
So I have two questions. One, I was wondering if you looked at differences. So when you meta-analyzed the different studies, if you did kind of compare, because I know these different definitions, potentially the kind of ones based on relative metrics that kind of account for acclimatization and adaptation versus the absolute, and maybe I missed it. I know you presented heat wave. But yeah, I guess I was wondering that. And then the other question was, I was wondering if you, I mean, I'm sure you did, but I'm curious what the kind of geographic, like where these studies are and where there's huge gaps, because I know that, you know, many low income, middle income countries just don't have any evidence. And if you looked at kind of the geographic distribution of the studies. But yeah, thank you so much. Really interesting work.
Okay, my internet broke up, so I didn't hear the last question, but I think I can guess. So there were very few studies that had a temperature threshold. Almost all the studies used a percentile. And so we lumped those studies together here in the high versus moderate because there are just not enough studies to look at that just had a specific temperature threshold. It's much easier for like, it's not easier per se. I mean, it would be nice to just have a temperature threshold, but I think without the physiology, I think there's an assumption that you separate that as a better estimate. But I think if you look at the physiology and you think about what is acting.
You broke up a little, Layla, so we didn't hear the last part of what you said. All right. Well, I think she's having some internet challenges. Oh, and now she's gone. Well, thank you all so much for joining, and feel free to reach out to Layla if you have more questions. And really appreciate you being here today. Have a great day. Take care.
Thanks.
Bye-bye.